On this edition of the Best Docs Network featuring Forest Park Medical Center, General Surgeon Charlotte Hodges, Colorectal Surgeon Dr. Robert Cloud, Infertility Specialist Dr. Lowell Koo, Neurosurgeon Jeffrey Catarini.
Hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network featuring Forest Park Medical Center, which of course one of the top medical centers in the entire Dallas-Fort Worth area.
It absolutely is, and this is a whole show dedicated to Forest Park Medical Centers and their fine physicians. Let's meet our first Forest Park physician, Dr. Richard Salter.
The Da Vinci robot has been used extensively in gynecology since about 2008, and it allows us to do major surgery on patients that used to would facilitate a large incision, but now we're able to do these through smaller, minimally invasive incisions, allowing the patient quicker recovery and quicker return to normal activities.
I work a full-time job. I perform on the weekends. I'm a jazz blues singer. The recovery time seemed to me to be a little bit more because of the weight issue. But the robotic procedure kind of lessens that fear.
Wanda was having a lot of pressure down below, and she stated that she felt like things were changing inside of her. She knew she had the fibroids, but she felt like they might be growing again. We did a sonogram. It showed that her uterus and fibroids collectively were about the size of a volleyball, and definitely could be causing the pressure and the abdominal pain that she was experiencing. It's kind of like a muscle cramp in the uterus. And unlike muscle cramps in our other muscles, these muscle cramps don't go away, they stay.
He explained the process to me, and I said, this is the person who's going to do the surgery. And there's another procedure, but the procedure was done. And within less than 2 weeks, I did a performance. I was very pleased with the outcome.
Well, we did her surgery in mid-afternoon or so, and I saw her that night. She says, I really could go home right now, but I think I'll just stay. So we kept her overnight. The next morning she felt great. She was ready to get out of there. I saw her back about 2 weeks later, and she had already done her first performance. I think she said it was 10 days from the time she had her surgery to the time she was back on stage.
I know my doctor said, don't do anything, don't drive for at least 3 or 4 days, but I felt good, you know. So, you know, I would recommend this to anyone who is thinking about having this procedure.
The Makoplasty is a robotic adjunct for joint replacement. It's good for inside of the knee, the outside of the knee, or combined inside and what's called patellofemoral or underneath the kneecap arthritis.
It's relatively advanced technology that helps increase the precision of the surgeries that we do. A lot of the orthopedic surgeries in the joint replacement field have a lot to do with measurements and alignments, amounts of cartilage and bone that we remove in order to replace either that exact amount or some variation.
The ideal candidate for Makoplasty is anyone who has usually mild to moderate arthritis that's confined to one. There's basically 3 compartments in the knee: the medial or inside compartment, the lateral or outside compartment, and the anterior compartment, which consists of a groove called the trochlea and the patella.
So having technology in this situation with Mako using the robot, which helps you to execute the plan that you have preoperatively to achieve a certain result. The robot is actually helping you during surgery. But a big part of the technology is the information that we get from the computer system with a preoperative study to help plan the surgery before we ever make an incision.
How Mako is different from the standard partial knee replacement is the excellent reproducibility of putting in the implant. One of the more difficult things about doing partial knee replacements is getting the implant in a good position and maintaining the soft tissue structures. The way the Mako system works with the CT, we do a CT scan and it tells us we can set exactly where we want our resection level to be, the exact angle of the implant, and it's 100% reproducible from our plan based on the CT scan. It's impossible to have that done any other way than with the robotic surgery. It will literally stop you from making a mistake.
Overall, Makoplasty knees are a significant improvement on a partial knee replacement that we've done for many years, and because it's done better and more precisely, it allows us to open up to a larger potential group of patients and get better short-term and long-term results.
It's literally the minimum of minimally invasive surgery for knee replacement.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way.
I'm currently in the OR manager position. I oversee the nurses, our RNs, our scrub techs, all of the individuals that are necessary to smooth running of the facility in the operating room. Monitor the operating room schedule to keep everything running on time as well as meeting the needs of our patients and our physicians. I decided very early on that I wanted to be a nurse. I enjoy people. I enjoy being able to serve the needs of others, and the operating room just really stood out to me. I think the OR is an area that's it's very scheduled, it's very routine. I like to be able to plan. One thing that really stood out about Forest Park was just the quality of patient care and just the way that the patients are treated. The physicians, everybody is just wonderful. The facility promotes patient satisfaction, patient care, which are all things that are very important to me, and it's a facility that I feel like I'm very in line with their values and what they view. One of the main reasons that physicians do enjoy coming to our facility is just with the extent that we do go to meet their demands and also provide them with what they would like for their cases. We want all of our physicians to have what they need to provide effective, safe surgery, but also to meet their preferences of what they would like.
Did you know that Forest Park Medical Center Pharmacy is equipped with a fax carousel? This system helps better manage inventory by automatically tracking drug inventories in near real time. This system also supports efficient packaging and labeling of medications within the pharmacy.
Had a lot of bloating and pressure in my abdomen, uneasy to breathe, would maybe get scared about it. I was looking at heart attack symptoms and went to the emergency room basically thinking I'm having a heart attack. They even tested me for everything on the heart attack scale, and then we went to further discussion with the doctor at the emergency room. Had a non-functioning gallbladder, was functioning very low, and then ran the test and saw the gallstones were very large, and immediately called Dr. Roshek and scheduled the time to visit with him that same day.
Basically, a gallbladder is something that stores the bile that your liver makes. The bile that your liver makes is what helps digest fat after you eat your hamburger, your fries, whatever it may be. When you eat something later down the road and you have some extra bile stored up from a previous meal or something like that, your brain says, oh look, here comes some more fat. Your gallbladder starts squeezing, and then more bile comes out.
First meeting with Dr. Roshek, I actually sat down with him. We discussed the history, any previous illnesses. He was very informative and what I loved about him is he listened, and he didn't mind questions. He reassured me that the gallbladder needed to come out.
There are two main reasons why your gallbladder can go bad. One is that you develop what's called gallstones. Gallstones are literally stones that form in your gallbladder, and unfortunately these stones can end up traveling out of your gallbladder and going into the main duct. That's the classic thing that causes pain. The other thing that can cause pain is that your gallbladder just doesn't work anymore. It just burns out and it won't squeeze the bile that's stored in there, and actually it hurts when that happens too.
The actual surgery, he told me that it would be laparoscopic. Recovery, he just said that after the surgery, I always constantly be walking, help the fear of blood clots, if you're just laying around, just get the exercise of soreness out, and that's exactly what I did.
Once the gallbladder is gone, the main duct that carries the bile from the liver to the intestine will actually dilate slightly. and the duct will become the new gallbladder. When you have your gallbladder and it's not working, we tell patients not to eat foods with fat. We try to minimize your fat intake so that your gallbladder isn't squeezing so often, causing the pain. Once your gallbladder's out, I tell patients you can eat whatever you want.
Dr. Roszak is top notch. He's excited about learning and taking care of people.
Now to our next Forest Park doctor, orthopedic surgeon Dr. Dan Aldridge, who performs ACL surgery.
ACL stands for anterior cruciate ligament, and it is a main ligament inside the knee. It is very commonly injured in sport, especially skiing, football, soccer, basketball, things that involve a lot of quick turns and twists, quick stops. That's when the ACL gets torn. It usually occurs in young, athletic, active patients.
Well, it was playing softball, first base, and they kind of overthrow me a lot. So this time I jumped up to try to catch it and just came down and on my knee wrong, and I could tell just immediately that probably tore it.
David was kind of a typical weekend warrior type of athlete who was playing softball, and it only takes one misstep and felt a pop, knew there was something wrong with the knee, didn't feel right, didn't feel steady, examined him, got his MRI. He had a classic tear of the ACL.
With Dr. Aldridge, he's a cadaver ligament, and the recovery time was less, and I was back, being active a lot sooner.
One of the advantages of using an allograft or a donor tendon is that you don't have to take any tissue from the patient. So it actually can be done almost entirely arthroscopically. We're talking about 2 tiny incisions about that big, and then one other very small incision to put the graft in, and that's it.
And then after the surgery, I worked my way back up through this therapy and stuff, but 1st of December I went snow skiing, and that was right in the 6-month period.
He definitely wanted to be active again and run and jump and do those things, and he was in his 30s, and so we scheduled him for his ACL, and he did extremely well. He was very diligent about doing his therapy and also not pushing it faster than we wanted him to, and holding off on running and sport until he was ready. And now he's back doing anything he wants to do.
My knees are very important to me, and not having the limitations of having a knee issue with them. So getting them repaired was very important in the fact of the activities that I do.
Before I had a chance to get with Dr. Hung, I was kind of suffering with allergies pretty severely, whether it be like sneezing or not being able to breathe or not being able to breathe without opening my mouth. And then also every time I would sneeze or have any allergic reaction, anything, it would swell up so severely no air could pass through. And so I had gone to multiple allergists my whole life.
Jennifer came to me because she was primarily experiencing nasal obstruction. It had been going on for most of her life. She did not have any clear history of any nasal injury or any accidents in the past, but she found that she was unable to breathe from both sides, but it seemed like her right side was more affected. And after years of medication, and she still wasn't getting the relief, and she still felt like she wasn't breathing as well as she should.
And we talked about if I wanted to do rhinoplasty as well, which I ended up doing because I did have a hump, and then they straightened it out, but I also wanted to not let it look like I had my nose fixed, if you will. And so he just took my bump out and then corrected my septum, which kind of straightened everything up.
The surgery entailed straightening out her septum and shrinking down the turbinate to create more room in both the right and left sides of her nostrils. I also used some of that septum to create some grafts to help support the nose, because part of Jennifer's problem was that the framework of the nose was starting to shift and collapse, contributing to her nasal obstruction. And so I used some of her septum to help re-support the nose.
You can make it as big a deal as you want, but for me personally, my recovery time was nothing. There was only upsides for me.
A lot of people just go through most of their lives really not knowing sort of the potential of of how well they can breathe through their nose. It's very hard to sort of be able to mimic with medications or anything like that what it's like to sort of optimally breathe.
It was literally one of the best things I've ever done.
As always, for more information on any of the amazing doctors you've seen on today's show, just go to our website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
That is the place to go. Right now, Forest Park Medical Center and their fine physicians are dedicated in helping change people's lives. Let's meet our next physician, Dr. Lowell Koo, infertility specialist.
We started trying to get pregnant probably in May 2008.
Right.
And so it took us, you know, we tried for about a year before we went and saw Dr. Koo, and then my OB recommended that we go see him.
Amy Baker and her husband unfortunately struggled with infertility for some time. Fortunately, they came and saw me at the office. We did a workup and found out that it was possible that she could still conceive.
Well, there were various tests that I had to go through in order to determine what was the issue. Both of us had to go through certain tests in order to determine what the issue was, and it turned out I had what's called PCOS, and so I wasn't ovulating regularly.
Amy and her husband initially began with some basic treatments for infertility, including insemination. We tried a few rounds of insemination without success, and so we moved quickly to in vitro fertilization. In vitro fertilization occurs where the patient takes medication to grow eggs on her ovaries, and then I go in and I harvest the eggs. We mix the eggs with the husband's sperm, and the embryos are formed. They're incubated for 3 to 5 days, and after 5 days, we grade them, and the best embryos are placed into the uterus.
Throughout the process, you get a little bit impatient and obviously just want it to happen as quickly as possible, but Dr. Koo makes sure that everything is perfect before moving forward so that you can have a successful procedure.
With Amy, we did transfer 2 embryos. They both looked healthy, but we weren't sure which one was going to make it. Unfortunately, they both made it. So we're very happy for them.
He was so kind and sensitive because obviously he knows it's a very upsetting time for a family who wants to have kids and is having trouble. And so he's very calming and very helpful in just explaining things to you and being very honest at the same time.
The chance for twins with in vitro can range between 33% up to 45%. We're always shooting for success with each try, with the first try especially, so we're very excited that Amy had success with her first try.
The girls are wonderful. They're obviously a lot of fun. Obviously, we're very thankful for everything he's done for us.
Ann was suffering from severe sinus problems, and she credits Dr. Colin Perro for helping change her life. To find out more about Ann's story and other life-changing stories, log on to bestdocsnetwork.com.
We're joined now by one of Forest Park Medical Center's founders and craniofacial plastic surgeon, Dr. David Genikov. Dr. Genikov, thanks for being with us today.
You're welcome.
If you would, start off by just talking to us a little bit about what brought you to practice medicine and specifically craniofacial plastic surgery.
I grew up in Dallas, and my father was an orthodontist here in Dallas, and he became part of the first craniofacial program down at UT Southwestern or Children's Medical Center in the late 60s, early 1970s with a physician named Ken Salyer. And so early on, I would see what my father did on the orthodontic side and still get to see what Ken did on the craniofacial side. And the transformations that the two of those guys did in the lives of children and their families I thought was extraordinary. I've always wanted to do craniofacial surgery. It's really the only reason I went into medicine, to be honest, was to be able to take care of these kids.
Wow, and talk to us about what is the most rewarding aspect of your job.
I enjoy taking care of patients from when they're small to when they're almost 18 years of age. I get to take care of kids almost for as long or longer than some pediatricians. Additionally, families move, but most of my patients, the vast majority of them, come back to see me on a yearly basis. So I get to watch them grow and see them mature over time, and I really enjoy that. The other thing I probably enjoy as much as anything else is the ability to take a child who is otherwise has low self-esteem or the environment looks on them differently
And if there's something that we can fix or enhance or improve, we do that, and the change it makes in that child, both physically, mentally, and with their self-esteem, to me is life-changing for me, and that's the main reason why I do it.
That's wonderful. You've been an integral part of the development of Forest Park Medical Center. Talk to us a little bit about how you came to the vision of Forest Park.
The National Health Service model in this country is beginning to be pulled through the large institutions. So, in other words, the big institutions are beginning to control their entire referral networks by buying practices and employing physicians. And so I didn't want to be part of that employed service model for a whole bunch of different reasons, not least of which I feel it would interrupt the relationship that I have with my patients. And so if I'm employed by a hospital system, they have the right to tell me what to do and when to do it, and that's not what I wanted to do.
Well, thank you so much for your time, Dr. Janikov.
My pleasure.
And now we'll watch another Forest Park physician help change someone's life.
My brother was diagnosed with glioblastoma tumor, and I started visiting him in California. And after the removal of his cancerous tumor, I started realizing I was having some issues with myself. Felt like a light pulsating headache, but it wasn't painful. A little bit of pain in my calf, and my neck was just bothering me. I saw my chiropractor. After about a month, he said, "Stella, I'm really good at adjusting necks, but for some reason why you're still having some issues and not getting any relief." He says, "I highly recommend you get an MRI." After about 2-3 weeks, I went ahead and agreed because the pain was just too painful. He calls me up a couple days later. He says, "Stella, you're right. You have some neck issues. You have 2 bulging discs, but in addition to that, you have a tumor."
Spinal cord tumors fall into 2 main large groups. One in the canal, which is what's called intradural extramedullary, but it's inside the covering of the spinal cord, and then pressing on the spinal cord from outside. And then another one is intradural intramedullary, where the tumor is within the covering of the spinal cord and then within the spinal cord substance itself.
And he explained the longer it stayed in me, it's going to press more and more against my nerves, and that's why I'm going to start to have more and more problems. "Dr. Catarini, if I was your wife, what would you suggest?" And he said, "Immediately take it out," and that's exactly what we did.
This is a model of the back of the skull, and then the front of the neck, and then the back of the neck. Stella's tumor was within the spinal canal itself. It was actually within the spinal cord itself. It was at the C3, C4 level, and these are lamina that were removed. We removed 2 of the lamina, making a small incision, localizing it here, opened up the covering of the spinal cord, and then went directly into the spinal cord itself to remove the tumor.
I just feel confident that whatever I had or whatever I may get in the future, I know I would always rely on him or go back to him.
Up next, Dr. Charlotte Hodges, general surgeon, talks about acute appendicitis.
So typically when an adult presents with appendicitis, they may or may not have some nausea and vomiting. They can have a fever. In the early stages, they may not have a fever, but it's generally with abdominal pain, usually centralized around their belly button. And then over several hours, it will begin to migrate down to their right lower quadrant.
I was at the gym. Remember on a Wednesday night, I went because I couldn't go that morning. Did my cardio, and I'm like, no weightlifting today. I just work my abs and go home, try to make it kind of short. And I worked my abs, I'm like, oh, wow. I guess I did too good of a job because they were like super sore. The next day came, and pain just came out of nowhere.
He went to his doctor, and when his doctor did a physical exam, he said, oh, I bet you have like an early appendicitis.
I ended up going to Forest Park Medical, and that's where I met Dr. Hodges.
Came to the ER, we got a CT scan of his abdomen, drew some labs on him, and he had a very early appendicitis.
They was like, yeah, your appendix is inflamed and swollen. You have to get it out of you ASAP.
You're able to do the appendectomy laparoscopically. Patient gets 3 small incisions, remove the appendix. It's generally an overnight stay, depending on what time that they present to the ER. At the time of surgery, if you do see that the patient has a large amount of pus in the abdomen, you can also opt at that time to also laparoscopically place a drain as well, and then remove their appendix at a later date.
Having my appendix taken out has a direct effect on me because I do play semi-pro football for the Greenville Bandits, and it's crazy because the season starts in 4 weeks, and I just had my appendix taken out, so I feel like, honest to God, true, I feel like I can go out there right now and play with the big boys, but you know, you got doctor's orders, and wow, you know, I just feel great. I'm really, really, really amazed with my results.
He's doing well. He was really nervous. He had never had surgery before, but he was a great patient. He did really well. He was able to go home the following day.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
I was told I had hemorrhoids, or what hemorrhoids were. I didn't know anything about them myself, except that to put a cream on them, and every time I went into the shower, they were falling down, which I didn't know. I thought they were trivial things, like a toothache or something would go away. It didn't happen.
Everybody has hemorrhoids, and they're anatomical columns or cushions of vascular tissue. You have internal hemorrhoids that are up inside the rectum that are covered by non-nerve-bearing lining. And they usually bleed, itch, prolapse in and out. External hemorrhoids, or the external portion of hemorrhoids, are covered by nerve-bearing skin. And therefore, when they swell or stretch or even clot, you can get a lot of pain.
I had no pain, which was unusual. I just had the falling down of my insides coming down.
William was having significant symptoms from his hemorrhoids, and he wanted relief of those symptoms, but he wasn't ready to have surgery. We dealt with the main problem areas with a treatment or two of banding and infrared laser, but I wasn't satisfied that this was going to eliminate his problem, and so I recommended at that point that he formally undergo internal and external hemorrhoidectomy, which he did, and he was very glad he did once he healed.
And since then, I've had no pain, no bleeding, no nothing. I can walk, run, and dance. I knew exactly where I was going because he had given me good advice, and it made my life a lot better, a lot easier. I'm very content.
That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center, of course, one of the top medical centers in the entire Dallas-Fort Worth area. And the good news, Candace, is for more information on Forest Park Medical Center or any of their great physicians, head to the website bestdocsnetwork.com, click on the Forest Park tab.
That's right. With unsurpassed service, exemplary care, and the highest quality medical facilities, prepare to have your expectations exceeded.
And for more information on any of the fine doctors and you have a question or comment for us, send us an email at info@bestdocsnetwork.com.
Thanks for tuning in. We'll see you next week.